Hello. Can you all see me? Hello, good evening. So, how are you? Hello, good evening. So, how are you? Let's wait for the kids. The link will be shared to many. Just give me 1 minute. Okay, now let us see why we are doing this quiz, everyone. Okay, because yes, now why we are doing this quiz? Shock surgery is very important topic for your NEET and for your INI. But when we are reading our notes, right, when we are reading books, we read everything around it and we forget shock. Okay, so if you have read shock, one question is going to come, beta. In the INI or in the NEET, one question is going to come, and one question determines your rank. Done? So let us now start with shock quiz. Then later I will tell you the batch, which is the new batch. I will tell how to study. Right? Not now. Let us first start with the quiz. Okay. Now, first question, everyone. First rule of quiz, no one is judging you. I am not going to judge you. Okay? If you know the answer, good. If you don't know, learn it. That is the purpose of this quiz. Whatever you don't know, learn it. Have it on tips. And we are going to have multiple quizzes, dental quiz also. For the INI, for the NEET, we are going to have. So that you don't forget the maximum, questions. 80% of questions will come from the 20%, and that 20% topics will be on your tips. Then rest, beta, whatever difficult questions are coming, we have to just let them go, right? We just have to let them go. We have to do the 80% of questions and we will be in top 10, right? Chalo, let us start. First question. Shock is a state of hypoperfusion, hyperperfusion. Quickly. Good evening. See, I have so many books because I am not surgery faculty, right? So I have so many books. I have very good. Very good. Which is the most common shock? Please write 1, 2 and 3. Excellent. Most common, very good. What is the best clinical parameter to know about how shock is progressing or how shock is being treated? Like, so what is the parameter? Not septic, beta. It is not septic. Septic is not that common. Okay, most common is hypovolumic. Excellent, spot on beta. अब अगर ऐसे क्वेश्चन आएंगे and if you are able to answer, then who will take away your seat? Tell me, is there anyone? Not blood pressure, no beta. Urine output is the main. Okay, most common clinical, they are not asking you. In the end I will summarize whole of the shock. Right now is a quiz section. Okay, so urine output. Very good. Next, in neurogenic shock, we see vasoconstriction. True or false? Quickly. Neurogenic, we see what? Don't worry if you don't know the answer. Abhi to we are just starting. Right? We will summarize also in the end. Very good. Why? Because neurogenic we have vasodilatation. Why? Because sympathetic tone is lost. है ना? So sympathetic tone is lost, especially in the spinal injuries. So neurogenic is always opposite. I will give you 3 magic charts which you have to learn, and then all questions will be sorted. Okay. Next question, everyone. In grade 1 hypovolumic shock, how much blood is lost? How much? 750, 1000, 2000, 2500. Grade 1. I'm not asking percent. Very, very good. Excellent. Next question. Yes. So, beta, percentage can come or this ml can come. Both should be on tips. It has to be on tips. Tell me in which shock do I see decreased, see decreased cardiac output? Decreased cardiac output. Only cardiogenic I see decreased cardiac output. Yes, you are giving me right answer beta, but think karo. Cardiac output is decreased in all, है ना? Hypovolumic maybe it is decreased, cardiogenic maybe it is decreased, right? Only in some septic shock cases it is increased, right? Otherwise it is decreased. Cardiac output is decreased. Okay, thank you. What is? No beta, so that means this magic chart we have to learn. So everyone please note down, we have to learn the magic chart for all the different types of shock, and don't worry, I will give you, you just have to memorize it. Okay, I am seeing yes Dr. Piyush, right, very right, but this chart I will give you and that has to be on your tips. Maximum questions are going to come from that. Next question beta, which is the solution, preferred solution for hypovolumic shock? Okay, why? Can anyone tell me why? See, this was your NEET question. INI is going to ask you why. Right? Beta, for the INI, we have to do very less surgery, very less medicine, very less physiology. So don't worry about those, the people who are preparing for INI. Don't worry. Leave that to me. Okay? We'll do that. Dental subjects, sir will be taking. So, and all the faculties will also be coming for the dental quiz. So we are not going to at all leave you. You are going to hate us, okay? By the end of the quizzes, you are going to hate us. Beta, everyone is talking about osmolarity. That is same for the normal saline also. Normal saline 0.9% that we are using. Acha, haan, same, okay. Okay, you are telling it for ringer lactate. Okay, good. Okay, similar properties to plasma, yes, but just one reason you should know, that normal saline, if it is given, it leads to, in some patients, hypercoagulable state. Okay, and ringer lactate doesn't lead to it. So that is the one of the major reasons we are using. Yes, the reason that you are giving, okay, it is almost equal to the plasma ECF, right? So that is also right, but one of the reason which came in the medical aims was this. Okay, so you should know that the normal saline leads to hypercoagulable states and ringer lactate does not. Fine, done. Now there is a patient, everyone, and he is, listen very carefully, anxious. His pulse is more than 120 beats per minute. His blood pressure is decreased. Pulse pressure is also decreased. Respiratory rate is 30 to 40. 30 to 40. Okay. Urine output is 5 to 15 milliliter per hour. Which grade of hypovolemia I am talking about? Patient is Ramu. Yes, patient is Ramu. Every patient is Ramu. And beta, if ever you feel let down in life, right, all those who are new, you should know every disease is present in Ramu. Ramu is my favorite patient. If you ever feel let down, grade 2 nahi hai, grade 3. Answer is grade 3 beta. Heart rate 30. Heart rate 30. Urine output was the catch point here. Urine output was around 5 to 15. If urine output was negligible, it would have become grade 4. In grade 2 beta, urine output is 20 to 30. Heart rate is more than 100, less than 120. Right? So I am going to give you a magic chart again. Second magic chart for knowing the hypovolemia different grading, which should be on tips beta. In oral surgery, head trauma, everywhere you are going to find this. Correct? Okay, next. Remind me in the end, I will tell you a story about Ramu, but not right now because right now is quiz time. Okay. Tell me true or false. Resuscitation in hypovolemic shock with colloids is no more effective. Matlab it is equivalent to the crystalloids. But still they are not used. Is it true statement? Why? Why they are not used? Okay, so everyone please write down this thing that resuscitation with the colloids is no more effective. Matlab it is not much effective. But we use crystalloids because they are less expensive, easily available. Okay, done. Next beta, most common cause of death. Most common cause of death in septic shock. Who will tell me? Most common most common cause of death in septic shock. Septic shock. Very good. No beta, hypotension. Hypotension. End organ failure, so beta it is occurring in the end. Hypotension. Please note this. Hypotension. Okay, plasma expanders. सोफा बेटा, सोफा तो हम ग्रेडिंग कर रहे हैं ना. सोफा इज अ ग्रेडिंग सिस्टम. बट हाइपोटेंशन, प्लीज नोट दिस लाइन बेटा. Hypotension is the most common cause of death in patients of septic shock. Multi-organ failure, yes, correct. But multi-organ failure beta occurs a little later. Suppose a patient has survived the hypotension phase. He is given a treatment. Then he will have multi-organ failure. But suppose a patient doesn't reach the hospital. Then he is going to die because of hypotension. Multi-organ failure, yes. But beta, that is end. Again, is this clear? Colloid one beta, it is just one line that came in the exam. INI, that colloids are almost equivalent to the crystalloids in treatment, but still we don't use it. Is it true? Yes, it is true. We don't use it in the hypovolemic shock. Preferred is always ringer lactate more than normal saline. Why? Because expense matters. Right? Okay, done. Next beta. Very good. MI. MI is a cause of which type of shock? Jaldi batao. Quickly. Very good, very good. Next, in distributive shock, have you heard this term? Distributive shock, we see low or high vascular resistance. What do we see? Low or high? Very good. Now there is a patient with warm extremities and inadequate afterload and low systemic vascular resistance. Which shock do you think it is? Which shock is it? In all other shock, neurogenic. Neurogenic is the answer, beta. Neurogenic. Okay. In all of in all the shocks, we see vasoconstriction. Vasoconstriction, except one. Is this a true statement? Beta, please remember, in all the shocks, we are having vasoconstriction. We are seeing cold, clammy extremities. Why? Because in the shock, the blood is directed towards important organs, heart, not to the hands. So the patient is going to have cold, clammy, right? Cold, clammy is the word. In hypovolemia, patient is going to have, right? In cardiogenic, patient is going to have, except in one which is neurogenic. Why? Because in that we are having vasodilation, right? Vasodilation leads to warm extremities. Yes, beta, it was generalized question about distributive. Yes, we have differences, but when it comes, you should know na, okay, distributive, he is talking about the neurogenic, right? Okay. Next question, very good. Okay, next question everyone, which is not included in the SIRS criteria. SIRS, you know, SIRS, which is not included. Temperature, TLC, heart rate, BP. Yes, Dr. Mansi, I am going to give you a chart for this. Septic shock, yes it does. Yes it does, but always question has come on the neurogenic. In the septic shock, there are certain gradations, early and later, right? Early septic shock, later septic shock, right? No, beta, TLC, no. So, now next question, you are going to write about SIRS criteria. Tell me, SIRS criteria, everyone, very important. This question has come in AIMS, in INI, in your NEET exam. What is the criteria for SIRS? What is sepsis? What is severe sepsis? What is septic shock? What is septic syndrome? Right? This should be on your tips. Chalo bata dein. Let's revise. No problem. If you don't know, beta, in your notebook, everyone, you are going to have a quiz notebook now, because quiz is going to happen throughout the year. Frequency is going to be less, but in the beginning, but later on it is going to be almost daily or day after. So you are going to make a copy. In that copy you are going to note what you were not able to do. So SIRS criteria, everyone. SIRS criteria, everyone, we will revise. Don't worry. Abhi I will just give you a quick recap also. Okay. Next. Do you know about the Apache score? Assessment of sepsis, Apache score. You don't have to know fully about Apache, just know APCHE score, that is used for shock assessment, that earlier used to be used for shock, right? No need to know the score, just know the name. Okay, suppose if this comes, this was used for shock, may come in your INI, earlier used. Now we are using SOFA, है so now we are using sequential organ failure assessments. Done? Okay, now let me quickly tell you about shock. Quickly let us revise shock and everything. You are only going, I am not going to tell you. Right? Now what is, see beta, please remember shock. Then after this I have a 20 question test for you. Again it is a quiz which you will do yourself. Right? I will post the answers. I am not going to, because it's a quiz, I am not teaching you anything. This is all from your notes. And if suppose I tend to say something different from your notes, then you will follow sir's notes. Understood? Because I have studied the question papers, I have studied your notes also. But if suppose there is some discrepancy, you will read your notes. Right? So these were all the questions which had come. Now first of all, magic chart revise karte hain beta. This is the first magic chart. Write it. Don't write it. There is no time to waste. I will give you the PDF, whatever you want, or you already have that in your notes. Right? So this is the first magic chart. You have to know about hypovolemia, hypovolemic shock, trauma patient, this much blood lost. What is going to be the features? So grade 1, 2, 3, 4, you are going to know about tachycardia, BP. You are going to know about the urine output. Right? So direct question will come from this chart. This you should know. Done? You all have it in your notes. Hypovolemic shock you have. Otherwise you will get this PDF which I have made. Okay, no problem. Next is this. Next is this one. Hypovolemic, heart is cardiogenic, neurogenic shock and septic shock. Now here I want you all to learn with me right now. Then you have to do the questions. 20 question test is there. That is for your self-assessment. Okay. Next, this is the second magic chart which you have to know. There is no escape, and all of you have answered right. Right? So this is hypovolemic. What happens to the heart rate? So heart rate is increased in all except neurogenic. Respiratory rate is increased in all except neurogenic. In neurogenic, bradycardia, bradypnea. Repeat karo. Quickly repeat. Neurogenic, bradycardia, bradypnea. Peripheral extremities. Cool. Everywhere cool. Now, in the septic shock, some people have written very nicely that in septic shock we are seeing warm extremities, ma'am. Yes, true. Initial phase. Initial mein what happens? Toxins come. Septic shock is majorly because of gram positive or gram negative. Answer quickly. Septic shock is because of which bacteria? Quickly batao. Acha, not visible on the left. Okay. Nobody will write. I will give you this. This is no sacred information. This is a common information. Okay? Aim for this quizzes. This should be on your tips by tomorrow. I don't want you to learn right now. Don't write. Okay. This answer you are going to find out. Septic shock or sepsis is occurring because of which bacteria. Right? Next beta. So please remember, when those bacteria, they release toxins. Initially, it becomes warm. So septic shock, initially warm, later cool. Okay? That is why everyone, if they ask you about the warm extremities and they give you option of neurogenic, septic, cardio, hypovolemic, you will mark neurogenic. Confusion over? Done? Next, this CVP. CVP, please remember, low in 3, high in your cardiogenic. Okay? Next is the treatment. So treatment you have to know. We have to give crystalloids. We have to give blood transfusion if lot of blood has been lost in the hypovolemic. Whereas inotropes are of use in the others. Done? Okay. Next beta, please, this I am just revising. Right? End parameters are first important, best clinical urine output. Right? Once you have learned this, maybe then you will learn this information. Otherwise not required. Because for us, urine output is going to come in the question. Next is perfusion and arterial mein MVOS. That is the best. MVOS is the best. Yes, lactate also we do. CVP is used. Central venous pressure beta. CVP is central venous pressure. MVOS is mixed venous oxygen saturation. No need to go into details of this, right? I don't think so such difficult question will come. But what questions will come? Bradycardia, bradypnea, worm, cool, toxins, septic shock, right? So this magic chart has to be on your tips. Second magic chart. Okay. Third one beta is your SIRS. This I have written first. Majorly question SIRS pe aaya. So SIRS should be there. What is the full form of SIRS? Everyone, right? You know it. Next, what is the criteria? Core temperature either more than 38, less than 36, both. Increase heart rate more than 90 per minute. Second criteria. Respiratory rate more than 20 per minute. Sometimes you will get about PaCO2. PaCO2 more than 32. Why? Because please remember everyone, इसको learn नहीं करना है, इसको समझना है. You know, we have to understand it. Respiratory rate, if it increases, ठीक है? If we do like this, right? Hyperventilation, we are throwing CO2 out. CO2 goes out, saturation in the body decreases. So PaCO2 is less. You don't have to learn this. This is understandable thing. Right? Next, fourth point is increase leukocyte count or decrease, right? Less than 4,000 or more than 12,000. That is important. Either ways it can be, right? So obviously BP is not a factor, right? What is sepsis? Sepsis is 2 or more SIR criteria plus documented blood infection. Severe sepsis is sepsis plus organ dysfunction. Organ dysfunction means especially, heart is the one which is affected, right? And septic shock is sepsis induced hypotension despite fluid resuscitation, and vasopressor has to be given, right? Sepsis plus multi-organ failure is septic syndrome. So beta, any definition can come in the INI, in the NEET definition. SIRS, sepsis, they will directly ask you what is sepsis. So you have to know it is plus documented blood infection. They may ask you what is septic shock. Okay, so that is sepsis and hypotension. Done. So this was your SIRS criteria. For this, 2 out of 4 criteria should be there for it to be SIRS, and 1 must be abnormal temperature or abnormal leukocyte count. So the first one and the last one are very important. Temperature, WBC. Learn karo ise. Ab bhi learn karo. CVP is central venous pressure, everyone. Central venous pressure. Right? Next beta, this is a question we know which many students get confused. Okay? The question will come if someone is having shock. Okay? And what is the best clinical, most commonly clinical used parameter? Urine output, urine output, urine output. That is your answer. Understood? If the examiner is in bad mood and he wants you to, get confused, then he will give a word ideal. Only if ideal is there in the question, you will give PCWP. That is pulmonary capillary wedge pressure. Otherwise, you will not give pulmonary capillary wedge pressure or CVP as the answer. Urinary output is the answer. Done? Okay, beta, sepsis ka last part. Okay, sepsis is 2 or more SIRS plus blood infection which has been documented that you got tested for. Severe sepsis is sepsis plus organ dysfunction. Septic shock, shock, right? So that in that hypotension will come. Most common cause of death in sepsis. Done? That is how you remember, right? So beta, hypotension despite fluid resuscitation. Right? Okay, done हो गया ना? Right? This was not a class. Now is your question. Start answering. Read the question. Write answer on a piece of paper. Don't answer here. Write it on a piece of paper. because I won't be able to check for so many students. One thing, I will be giving you the answers. Once the quiz is over, I will be posting it in the various groups, right? And you are going to check, right? Because you are your master. Question number 1. Is it readable or should I read for you? Okay, I'll read it. A 25-year-old with abdominal trauma plus hypovolumic shock, unresponsive to crystalloids. What is next step? A, B, C, D. Write down on a piece of paper. Dr. Surbi, when will the answer be CVP? I will ask, sir. Right? This is what, I gathered from the various 10-year past year papers. Whatever your doubts are, you can either ask sir or I will ask sir and let you know. Right? Because I am not surgery faculty. Don't answer, everyone. Don't answer. Okay? Think karo har question mein. These are your past year questions. Okay, next. This to question number 2 you can answer. Best parameter to monitor hypovolumic shock I have already discussed. No confusion. See, in this quiz, I will just tell you what to read. Okay? Next. So that you don't forget it. Question number 3. Increased cardiac output seen in self-test a beta. 20 question. Finish. Shock is over. Shock is no more a shock. Right? Done. Question number 4. What is given immediately in hemorrhagic shock? Immediately. Packed RBC, colloids, crystalloids, isotonic. I think this also you will be able to answer. Yes? Question 5. You will answer. I know my students. Plasma expanders are most useful in which shock? Septic, anaphylaxis, neurogenic, cardiogenic. Anaphylaxis, everyone. Note down. Note down karo. Anaphylaxis, you have to know everything. Microbiology, IgE. You have to know the treatment, adrenaline. You have to know the dosage, pharmacology. Kitna dosage, you have to know where it is given, how much, what is 1:1000, 1:10,000, 1:20,000. So homework for you. Anaphylaxis, treatment. Anaphylaxis treatment, everything should be on tips. Treatment हो गया, उसका pathology, microbiology, whatever you wanna say. Okay, which type of hypersensitivity is it? Done? Next, neurogenic shock is by. Some confusion will be there in question number 6. But I have just discussed it. Question number 6. Burns, dehydration, hemorrhage, anesthesia. Quick होना चाहिए बेटा. Quiz का meaning है quick. Which is preferred fluid in polytraumatic patient with shock? I know you know it. RL is ringer lactate, NS is normal saline, dextran, dextrose. First fluid of choice in hypovolumic shock. This also I think you can answer. Dextran, normal saline, dextrose, normal saline, Hartmann solution. Next, question number 9. All are criteria for SIRS in children except. This so I have taught you right now. If you have understood the 4 criteria, you will answer it. Done? 9 done? 10. A burn patient was born to emergency. Brought, not born, okay, brought to emergency. Upon examination, he was found dead. What could be possible cause? Burn का भी question है and it is of a shock also. Sepsis, hypoxia, malnutrition, hypovolemia. Next important question is burn में which bacteria or whichever organism has maximum chance of infection. Right, this is for your knowledge. Very important repeat question. Done. Question number 10 done. Question number 11. Which is the most dependable factor for fluid resuscitation? Dependable. Urine output, CVP, pulse rate, BP. ये तो I have repeated. Very good everyone. Very good. Repeat किया ना, you will be able to answer. Don't get confused कि CVP भी हो सकता है, नहीं हो सकता. ठीक है. देखो बेटा, in the exam, when you know an answer as a fill in the blanks, there is a sure shot way कि you are going to win. But that doesn't mean you will not read the full options. You know the answer, which is the most dependable urine output. But read A, B, C, D. Don't just mark A. Full, you should read full, but know the answer in your head. Question number 12. During surgery, a patient went into class 3 hemorrhagic shock due to injury to a critical blood vessel. Which cannula is to be used? INI question. This question I am sure it will be a little difficult. Yes. But then this question number 12 emphasizes one thing. Past year question. If someone has done past year questions, this question will be piece of cake. Right? Okay, next. Very good. Very good. Okay. Now, what is modified shock index? Modified shock index. What is shock index? You should know. Question number 13. Heart rate, I'll just say the options. Heart rate by SBP, heart rate by diastolic, heart rate by MAP, and peripheral resistance by systolic BP. But beta, you should know the short forms. Okay? Short forms you should know, because in the exam you may get this. Then there will be no Jasmine ma'am to tell you. Right? Okay. Now, what is class 3 hemorrhagic shock? Ye to a piece of cake now. Magic chart beta. I've given you 2. The third one I will give you. Okay? Don't answer no. Don't answer no. Answer on your copy. Okay? Now, question 15. In hypovolemic shock, which organ is assessed for determining underperfusion? Same question, repeated question. Organ पूछा है. Repeat question है ये. मतलब repeat in the sense, this is a very common question. The examiner just twisted it. Now, instead of saying urine output, he is asking you organ. Can you tell me? Urine is made by which organ? है ना? Right? So, this is how the questions are going to be framed. Question number 16. Shock index. It is not modified. So, you have 2 kind of indexes. Shock index, modified. Both you should know. In both you should not get confused. Done? Marked? PR. Peripheral resistance, BP by PR, CVP, central venous pressure, PCWP, pulmonary capillary wedge pressure. Question number 17. Class 1 hemorrhagic shock. Again, these all are your PYQs. So if you are able to answer, spot on, yes. Next, question 18. Patient having profuse bleeding per rectum and cold clammy extremities. CVP is 2 centimeter H2O. Normal is 2 to 10 or 6 to 10. Some books also say 6 to 10. Right? You don't need to learn that. Right? So tell me, which shock is it now? बहुत easy है. 2 catch points are there. 2 catch points. Your answer you know. You know it is this, but still read the options. Don't become a hero in the exam, okay? I know it, I'm just going to mark A. No. Answer should be in your head, but read the options. Right? Next, which is true for shock? Hypotension, hypoperfusion, hypoxia, all. What is true? Next, 20, last question. We started with SIRS, now we are ending with SIRS, which is not a part of SIRS. Now, I think every one of you will know. Done? Okay, quiz over. Now beta, in shock, I am just telling you what you have to do. You have to know the 3 magic charts. Hypovolemic, okay, that one. The blood loss chart. Next shock beta, sometimes they ask you about hypovolemic, cardiogenic, obstructive. Obstructive also is a kind of shock. Obstructive shock. Then don't get confused. And a distributive shock. So once you have done the 2 magic charts, then you learn this third one. Right? What happens to this? What happens to the cardiac output? What happens to everything? You should know. Okay, this is the third magic chart. Sometimes they love to give you obstruction. Sometimes. That is why I have not put it in the 1 and 2. First 2 charts, they are very important. You cannot forget. And distributive may, very rightly you have said, it includes the 3. Neurogenic also is there, anaphylaxis is also there, septic is also there. Right? So, please remember these 2 charts. Please remember the treatment. What is the treatment that we are giving? Right? Just give me 1 second. I'll just check one. Okay. Okay, yes, this thing beta, end point of resuscitation. End point of resuscitation. Please note, these are the 3 criteria to know when do you have to end the resuscitation for the shock treatment. Please note, lactate, base deficit, and the first one will be mixed venous. Right? Please remember, in the septic shock, we may give a vasopressor agent. Cardiogenic may we give the inotropic. Okay, someone is asking what is base deficit. Beta, base deficit is, it tells you about acid, how much more acid is present. When we do the acid base disturbances, then you will know that base deficit is something that tells us about whether the acid is excess or not. How much more base has to be given to the person to neutralize that acid. So base deficit. Done? Done, everyone? So this was all about quiz. All of those who are preparing for INI, you may please leave. You may please leave, everyone. Okay, end point. Ye raha beta, end point. 3 end points. Dr. Kamlashna beta, the quiz is not for teaching. It is not for that. It is for, you should know. Okay, you have to read all this. So you have to go back to your notes. You have to learn it. And I will give you the answers. But the point over here is not to give you answer. Right? That will be like I can give you at the end, while we are reaching the end of exam. Right? We are just reaching the exam just 2 months before. But right now I want you to read your notes. That is the point. Right? That is why I am not discussing. Answers I will share. Don't worry. Okay, now please leave, everyone whoever is preparing for INI. Please go. Please go. I just want to talk to people who are preparing for the next NEET. Okay? Now, have you understood how to read a topic? Simple. This was my aim for taking quiz. Right? There are 2 aims basically. One, at the beginning I want to tell you what to read from shock. Second, by the end, I want shock to be on your tips. Right? So that beta, it will be a piece. There will be nobody in comparison to you in the whole of India when we will do pharmacology, we will do medicine, physio, even now dental. Okay? So if you are able to answer these questions, can anyone take your seat away? Batao? Can anyone take your seat away? Beta, surgery is a big subject. Medicine is a big subject. Like physiology, biochemistry, everything, they are little difficult subjects for us. Right? But they are going to be a piece of cake because you are going to have a triple thing. Triple thing matlab, first lectures. Then I am not going to leave you for the quizzes. You have to come in the quiz. Right? maybe, you know, at one point of time, you will know surgery more than me. So should I be ashamed? Should I be ashamed of not taking your quiz? Okay, you know more than me? Nahi na? So no shame, nothing. If you know the topic, you've read it, come. Answer wrong. It's okay. It's okay. Answer wrong, because, you know, at one point in this whole year, you are going to outsmart us. You are going to outsmart the faculties. You know that? Because you are going to reread everything. And, you know, that day we'll be very proud. When you will be the masters of all the subjects. Done? So you have to know, one, what you have to read. Now from the shock is not going to be 5 pages or 3 pages of your notes or so many questions. It is not going to be that. Shock is just going to be the 2 or 3 magic charts and sirs. Finish. Sirs. Because ringer lactate, we will mark it. That's it. Correct? So that is how you have to learn. Right? And that is how you have to study every subject. Every subject. Right? Be it medical, be it dental. Take a look at the past years. Right? Know what is being asked and learn. For that, you know, I will be taking the quiz, so you don't have to do that hard work. But your notes, one. Second, your past year questions. And third, repeated revision. That is the mantra. That is it. There is no other magic potion for your seat. Understood? So there was a question on your group beta, in the live group. Okay, notes are so vast. How do I revise? How do I study? So now do you know how to study? Yes or no? Write yes or no and then go. Batao. Haan, story I will tell you. Do you know yes or no? Because this batch beta, somehow you can say, okay, we have learnt one point. You know, last batch also we used to have lots of quizzes, right? And you know the result, right? You all know the result. And this time also, you know, we are going to make you learn everything. End me, you will say कि paper was such an easy paper. कुछ नहीं है paper में, right? Yes or no? I want everyone. Do you know? See, surgery में this, I will make you learn every topic like this, but you have to learn it yourself. Okay, I can't make you study it. Okay, good. Now story beta kuch nahi hai. See, every patient, surgery, micro, every disease, you know, whatever I will be dealing in quiz, or I will be taking in the you know, medicine, he will be Ramu, you know. And at the end, you know, I realized why I always name Ramu, because Ramu, you know, he is a survivor. You know, he has everything. Any disease you think of, he is Ramu. Right? Ramu had a surgery, Ramu had RTA. But still, you know, he is living. Imagine. He is a living person. Right? So never lose hope. Never lose hope. This 1 year is going to be roller coaster. Don't lose hope. And today only, you know, I got a message from a student, okay, ma'am, internship is there. And that is a very true thing. That is a very true thing. It is not an excuse. Very true thing. Internship is there. Very hectic. We can't study. True. But then, you know, I told that person also that there will be days when you cannot, when you can run. You are doing very well. Run that day. Then there will be days when you cannot even run. You will walk. So walk. Study 2 pages, 3 pages. Done. Then there will be days where you can't even study 1 page. Then you have to crawl. Okay, I will read just 1 line. That's it. You just have to continue. So 3 things, beta, be ready. Next quiz, Dr. Sagar, abhi I am having weekly, or maybe I'll meet you, if you like it, I'll meet you early. Right? That is up to you. I don't mind. I just have to open up my books. I just have to read for 2 hours, you know, find out questions and take the quiz. But you have to memorize the topic. So whenever you all will be comfortable, I will take it. Okay? Done, beta? So shock, revise whatever I have told you. No extra information to be learned as of now. Because only this much we can remember. Rest, we can't. Right? Chalo, very good. Very good. This year round, We will be taking quizzes. Dental also. Last year I didn't take dental because obviously I can't take dental, but sir will be taking dental. Okay, last year batch tha beta, dental mein they were very good, है ना? And you will be also very good because dental is your heart, right? Medical is what we are afraid of. So I thought we will take medical quiz, and it has worked wonders. Right now this year we are not going to even leave the dental. We are going to take the quiz and you are going to get a seat. There is no doubt about it. Okay, go now. Go now, beta. I will share the PDF. Don't worry. Everything I write or we do is for you. It's for nobody else. Right? So this PPT, this whatever PDF will be there on the app. You watch it. Okay? But again, I am saying you have to read and refer sir's notes. If there is some contradiction, then you tell me also and you follow what sir has taught you. Because as such, I am not that well versed with the surgery. I am not that faculty. So, sir is like the ultimate. Right? Okay. Bye. Go now. Good night. Good night.